Hey everybody, Daniela here, and thank you for joining us for your weekly dose of inspiration, education, and encouragement. Today I have the lovely Tiffany Crews joining us to chat all about a very important topic that I honestly don't think gets enough chatter. We're talking about how to treat skin of color. So, Tiffany, thank you so much for being here.
Thank you. It's my pleasure.
So you and I went to aesthetic school about 10 years ago. We went around at the same time about 10 years ago. And I remember in school, I learned about the Fitzpatrick scale as a way to measure pigmentation in skin. But I really didn't think too much about it after that because I was practicing in Hawaii, and in Hawaii it's predominantly Caucasian, Asian, and Pacific Islanders. And so I got very comfortable in that bubble. I understood how their skin type would react to different treatments and products, and it was very kind of safe for me. And then I moved to Boston, and everything changed. I moved to Boston, and I had a significant increase in African American patients and Indian patients. And I was doing treatments on them, and the same kind of treatments that I would do to address conditions on my patients in Hawaii, but their skin was reacting differently. And so I was like, wow, I have a lot to learn about skin of color. I realized that, I thought I was this experienced esthetician, and there was this whole other area that I just really felt like I was in kindergarten at. And so it kind of inspired me to want to do more research. And then I realized, like, it was challenging to find, you can find information about acne or whatever we're looking up. It's kind of all over the internet, but specifics on how to treat skin of color was a little more challenging to find. I know that you have actually been successful in finding some really great training opportunities and resources, and have kind of devoted yourself to making that your specialty. Can you tell us a little bit about the trainings that you've gone to, and how you really learned about the best ways to treat skin of color?
Absolutely. Again, this has been a passion of mine for a long time, just because not only am I a licensed esthetician, but I'm also a woman of color, and I am also a patient. I receive a lot of the services and treatments that I recommend to my patients, and I believe in trying them out before I recommend them to my patients and educate them on them. So, definitely, I had to do some homework. I had to look for postgraduate training because, like you, in my training programs for school, they really didn't address skin of color. There was not one chapter in any of my textbooks in my 1,200 hours of training that talked specifically about skin of color outside of the Fitzpatrick skin typing scale, as you mentioned previously. So I went on the hunt to look for other educational opportunities. And so I pretty much did a lot of Google searching, and I came across the Journal of Drugs and Dermatology. They have an online membership that's only $15 a month, so very feasible, very affordable.
Mm-hmm.
And they have a slew of peer reviewed medical journals written by dermatologists and scientists who tend to work heavily with skin of color patients, or they specialize in working with skin of color. And so they have a whole section that's devoted to skin of color. And it's just a wealth of articles that talk about skin of color and acne, or skin of color and certain ingredients, or retinoids, or lasers and chemical peels, and how to treat their skin and how their skin is going to respond, and how to have a different approach than you would with other skin types. So that was one avenue. The other avenues that I came upon were two conferences that are held. One is annually, and one is biannually. And the first one that's annually is called the Skin of Color Seminar Series. That's actually hosted in the Times Square area of New York every spring. And dermatologists from all over the country come and they give seminars about skin of color. And they talk about the latest and greatest treatments, or services, or ingredients that best treat or suit skin of color patients. They have a lot of exhibitors that come with their products that work well for patients. And then the other one is hosted by the Hampton University Skin of Color Research Institute. It's called the Skin of Color Symposium. That one's hosted biannually, and right here in my neck of the woods in the Tidewater area of Virginia. And that one is also the same thing. They have a lot of dermatologists that come in and they talk about all things pertaining to skin of color. So it's a great resource and educational tool that I found to be very effective in my research and in my journey to grow in this.
And it all sounds very credible too. Like you're getting your
Right.
information from, I mean, JDD is like the Bible for
Right. It's
dermatologists.
the Bible for estheticians. Yes.
Yeah. So that's amazing. I love that those, and we'll definitely include a lot of these resources and information below the post, so estheticians can, really do their research. It's something. I mean, we're trained to treat skin. It's not just this type of skin or that type of skin. We really should all be trained in all types of skin and how they react. So we'll definitely include the resources under there. So what would you say? After doing your research and everything, what would you say is the primary difference in the way that skin of color reacts? You mentioned lasers, which is, obviously lasers typically target pigment, blood, or water. So if they're targeting pigment, obviously that would be an issue with skin of color. But what other, how does it react differently, like with products, chemical peels, and just in general?
Gotcha. So in general, skin of color is very sensitive to trauma. And in our industry, primarily the majority of what we do is to create a controlled injury or wound to the skin to stimulate a collagen remodeling process. Now, with skin of color, you just have to have a precautionary, conservative approach because we are very sensitive to hyper or hypopigmentation when trauma is administered to our skin. As you know, when you get a mosquito bite, or fall asleep, or we burn ourselves with a flat iron, as women of color, we tend to hyperpigment because our pigment producing cells want to go to that wound site. And, in the healing process, it creates an excessive amount of pigment. And then we have to use some kind of bleaching or brightening cream to alleviate that. So I just find that using a very conservative precautionary approach when I am selecting what acids to use for chemical peels, there are some brands out there that make peels exclusively for skin of color. Or when I'm looking at doing a microdermabrasion, making sure that I'm using conservative settings, or that I prep the skin appropriately. And even when I'm doing laser hair removal, that, I prefer an Nd:YAG because I know it's the safest laser for skin of color. And I start with conservative settings because the last thing I want to do is create unwanted pigment. Mm-hmm. So that's one of the main differences, is just using conservative approaches with your product selection, your ingredient selection, your treatment selection. The other thing that I found with skin of color patients is they're much more prone to transepidermal water loss, or better known as TOOL. The skin dehydrated. Skin of color patients tend to have a more compacted epidermis. And sometimes it's just hard for that water to get to the outer layer of the skin. It evaporates prior to that. So I find in my research that TOOL is something that a lot of skin of color, whether it's Asian or African American or Hispanic patients, suffer more from than non-skin of color patients. So that was something else that I discovered as well. And even with, acne, sometimes it's really more difficult because it's not just the acne we're treating, also the post-inflammatory hyperpigmentation we're trying to avoid as well. Mm-hmm. So you have to have kind of like a multimodal approach when you're treating a person of color for their acne conditions or their pigmentary conditions.
So how do you define a person of color? Because in regards to when you're treating them, because if we look at the Fitzpatrick scale, you can have an African American person that's a 3, or you can have an African American person that's a 6. So exactly. How do you define, when we're, as estheticians, when we're thinking, okay, should I consider this person a person of color in my, approach to treatment? How do you define that?
So in my experience, skin of color is defined as non-Caucasian skin types, which Fitzpatrick classifications comprise from types 3 through 6. And as people of color, we're all different shades. And so the key thing I find is to have a very thorough consultation. Mm-hmm. question of, would you mind sharing with me your ethnic background? Because just looking at people these days, you're just not going to be able to tell. And it's important, especially when you're doing laser services and having to set certain parameters, that you have that information. So a lot of times I ask that, or if it's on the intake form, I make sure that we go over their background consists of, so I can know how to approach the treatment settings that I need to use. And then it's funny, in my research, I found that presently individuals with pigmented skin comprise 80% of the world population. And by the year 2056, greater than 50% of our U.S. population will be non-Caucasian. So I find it to be very crucial for skin into skin of color, because that's what our world is evolving to.
Absolutely. Yeah. And, as estheticians, we're treating skin,
Right.
it's all skin. So I think it is a very, very important topic. So you had mentioned the JDD subscription and the 2 conferences. Are there any other additional resources for estheticians who are interested in learning more about how to treat skin of color that you would recommend?
Yes, absolutely. So another resource that I do is I follow several dermatologists on Instagram or their Facebook page that particularly have a specialization in working with skin of color patients. I found that they post a lot of information free of charge regarding the topics that a lot of us want to be educated on a little bit more, and that's been great. So I really just, typed in, dermatology and skin of color, or dermatologists that specialize in skin of color, and I got a wealth of names that would come up on Facebook or Instagram. So I found that to be a helpful resource. There's also a lot of dermatology textbooks out there that specialize in the topic of skin of color that you can purchase. And then there's also an esthetician by the name of Pamela Springer. She is a licensed esthetician and founder of Global Skin Solutions. She has created her own skincare line that is devoted just to helping skin of color patients, and it also includes retail and back bar products as well as chemical peels. And she also teaches educational courses throughout the country on dealing with skin of color. Her classes are uniquely named "Don't Be Afraid of the Dark." So I like the title that she chose. So I think there is definitely a wealth of knowledge out there. You just have to maybe do a little digging, but it's available.
I'll have to be sure to include her links in there too. That sounds great. You have to make it fun, because I think it's a topic that some people are afraid to talk about, or they want to avoid treating skin of color because they don't know how to do it, and it's perceived as harder or more difficult. And the reality is, with education, everything is hard without education. But when you just find those resources, then it's skin. We just have to know how to approach it. So perfect. Well, thank you so much for your time and for these resources. This is going to be a long blog post because I know we've got a lot of extra links to put under there. But again, I think it's a very, very important topic, and I so appreciate your time.
Oh, thank you for having me. It was fun and I enjoyed it. Thank you.
Very good. And so now to all the estheticians and aesthetic experts out there, if you have studied different classes or have resources or anything like that, share your knowledge on how to treat skin of color in the comments section of this post so we can all continue to learn and keep the conversation going about this topic. Until next time, keep making the world a more beautiful place inside and out.